Hello, and welcome to another edition of the Eye Associates Sight for Life and so much more. I'm Jill Graw, Patient Care Coordinator at the Eye Associates. The Eye Associates specializes in restoring and improving sight. We take great pride in our vast knowledge, educational standards, and quality patient care. I'm proud to say that we've been repeatedly chosen as best ophthalmologists, best optometrists, and best eyewear by our community. Today, we will be talking about dry eye syndrome, a common complaint that we hear from our patients every day. And I have here with me today three of the most well-respected physicians in our area to help you understand what you can do to find relief from dry eyes. Welcome, Dr. Hector, welcome, Dr. Foster, and welcome, Dr. Hahn. Dr. Hector, I know that you are a fellowship trained in cornea and dry eye specialist. Tell our audience a little bit more about your training and experience.
Well, I've been in Bradenton for over 24 years. Prior to that, I spent 13 years in the military where I attained the rank of lieutenant colonel. But I did do my specialty training at Emory University where I was introduced to the seriousness of dry eye syndrome.
Well, Dr. Foster, I know you are also fellowship trained in cornea and a dry eye specialist, and you are one of the newest members to the Eye Associates team.
Yep.
Welcome.
Thank you.
Tell our audience a little bit more about yourself and your training.
Sure. Thank you, Jill. Well, it's been my pleasure to join the organization. It's been a great experience for me so far. I actually grew up on the east coast of Florida, met my wife at the University of Florida, who's a Bradenton girl, born and raised. I did my training at Emory University and Wake Forest University, and then went back to Atlanta for a cornea fellowship.
Well, welcome. Dr. Hahn, let's see, you are also a board certified and residency trained optometric physician, but can you tell us a little bit more about your background and experience?
Sure. After graduating from the University of Florida, I attended optometry school at the New England College of Optometry in Boston. And after that, I did an additional year of training and specializing in looking at ocular diseases like dry eye. And that's where I learned a lot about some of the things we're going to talk about today and really studied dry eye syndrome.
Now, I understand that there's an estimated over 25 million Americans that suffer from dry eye syndrome. Dr. Hector, can you tell us and explain to our audience what is dry eye syndrome?
Dry eye syndrome is a common term that, in my opinion, has been overused these days because it covers too vast a variety of what's really a dysfunction of our tear film.
Well, Dr. Foster, what would be some of the everyday symptoms that a patient with dry eye syndrome would experience?
Yeah, and there's quite a few, Jill, different symptoms that we hear. Of course, the sensation of dryness, sand, or grit on the surface of the eye. And fluctuating vision is another very common complaint. And then other things like burning, itching, and irritation, and even difficulty reading at the end of the day, and excessive tearing as well. These are all things that can be related to dry eye syndrome.
So, Dr. Hector, whenever you say tearing, and we're talking about dry eyes, it can really mean that you're experiencing the dry eye symptoms.
Yeah, a lot of people find this very confusing, and I have patients that come in every day that describe their excessive tearing, and when I describe to them that it's dry eye syndrome, they say, "Doctor, you're not listening to me, my eyes watered too much." But they're suffering from the reflex tears, and if you're experiencing reflex tearing, your eyes have really become very dry.
And that reflex tearing will actually exacerbate the dryness.
It does.
It will wash away the normal tears that constantly sit on the eye.
So, Dr. Foster, the tear film is really complex.
It is, and it's an area of study that has really been important because it's so complex, and a lot of ophthalmologists and optometrists are focusing a lot of time on that, just because it's a multifactorial issue. There's a lot of different things that we're learning. There are 3 layers to the tear film. There's a lipid layer, which is a superficial layer that coats the tear film, and that protects the tears from evaporation. Most of the tears are liquid or aqueous, and then there's a very thin layer of protection on the surface of the cornea, which is mucus. And any of these 3 layers need to be present to have a healthy surface of the eye. If any layer is absent or damaged, then you can have a problem.
So, Dr. Hahn, with dry eye syndrome, who gets dry eye syndrome and why would they get dry eyes?
There are many risk factors that can contribute to someone developing dry eye syndrome. We know that age is one of the primary risk factors. As we get older, it becomes more difficult for our different mechanisms to compensate for some of the drying that occurs. We know that environmental factors will contribute, and it's also a risk factor. So that means that the ceiling fans or the low humidity in the air will exacerbate things. We know that medications are a risk factor. So allergy medicines, antihistamine medicines, antidepressants, birth control, different things that we use for acne treatment can also exacerbate dryness of the eye. And then whenever you take those risk factors and then you compound that by adding something like a contact lens on the eye, that could make the eye even more dry.
And the use of computers these days. The people are constantly on their computer, and that hour after hour of staring can aggravate a dry eye condition.
When we stare at a computer monitor, we tend to not blink as much. So as your blink rate decreases, the evaporation rate increases, meaning that your eyes get drier even faster.
Can contact lenses contribute to dry eyes?
Absolutely. So whenever the contact lenses are sitting on the surface of the eye, they can actually act like a sponge and whisk the moisture away, making them dry. Plus, when the lens is there, that complex tear layer Dr. Foster is mentioning, the contact lens will actually disrupt some of that tear film and then make the eyes dry.
Well, Dr. Hahn, can other eye diseases actually be associated with dry eye syndrome?
There are many eye diseases and conditions that will mimic dry eye. So for example, if you have an allergy eye, you'll get some tearing, you'll get some redness, and sometimes that will look like dry eye, and only with careful examination can you differentiate some of those things. Some people will get chronic eye infections, and that can mimic dry eye, or that can cause a dryness of the eye. One of the more common eyelid infections that we see in the office is something called blepharitis, and that's where some of the oil glands will become blocked, and then that will affect the oil layer of that tear film, and then that can make the tears evaporate too quickly, and then again creating a lot of that dryness.
Well, I know, Dr. Foster, that you do cataract surgery and you also do LASIK surgery. Do those surgeries contribute to dry eye syndrome?
Well, it's a fantastic question. It's something we're always thinking about. Any ocular surgery can make any existing dryness worse. And the studies have shown that after LASIK or cataract surgery, those with a propensity for dryness can have a worsening in the 2 to 3 months while they're healing. And so that's something very important to know. And as a cornea specialist and a cataract and LASIK surgeon, I'm always looking for even mild cases of dryness and making sure that we treat them aggressively. And that's something that we take very seriously at the Eye Associates because our measurements are affected, and just making sure that the surface of the eye is optimized for surgery leads to a faster recovery and better outcomes. So it's really important.
I think we've done an excellent job of identifying those patients early on and being able to prevent those problems from occurring.
So treat it before you
Exactly.
go forward with the surgery. Dr. Hector, are there other systemic diseases that can be associated with dry eye syndrome?
Absolutely. The most common is rheumatoid arthritis. In fact, the vast variety of autoimmune diseases has the side effect of dry eyes, because in many cases, dry eyes, like having arthritis of the eyelids, there's inflammation that affects the quality of the tear film. So that's a very common combination. Sjogren's, where it's arthritis, dry eye, dry mouth, is a very distinct entity of this autoimmune disorder.
Dr. Hahn, what type of testing do you do to diagnose dry eye syndrome?
When a patient is coming in and we're specifically looking at their dry eye complaints, there's a special questionnaire we use to really see when the dry eye is affecting them. We also look very closely, carefully at their tear meniscus, or where the tears sit on the eye, making sure they have the proper amount of tears that should always be there. We use varying different eye drops that you wouldn't normally have in a regular eye exam, because these eye drops will help to pick out where the dry spots are forming. There are different sections or different types of dryness that can occur. And we're also looking at the evaporation rate of the tears. So again, trying to figure out, is your dryness from lack of moisture? Is it because the moisture evaporates too quickly? And then once we differentiate your specific type of dryness, then we can custom tailor a treatment option that will work for you.
So it's not a one-size-fits-all.
Right.
Well, Dr. Hector, what is the cure for dry eye syndrome?
Well, Jill, the sad part is there is no cure. And so that's why we have to get our patients on a daily program, hygiene, nutrition, that will provide them relief for the rest of their life, because there is no magic bullet to the dry eye.
So, Dr. Foster, if there is no cure, what are some of the treatments available for dry eyes?
Definitely. It's a very good question, and fortunately there are a lot of very effective treatments, it's really, we really take a comprehensive approach and customize treatments based on the patient's own conditions, their lifestyle habits. Some of the things, of course, are preservative-free tears is something we often recommend. We can do a very simple procedure in the office, which is to plug the tear drain, and that's something we'll talk more about in a little bit. And then, of course, there are prescription medications that we can use as well.
Such as Restasis. Right?
Definitely.
Right.
Well, Dr. Hector, you mentioned Restasis. It is a prescription. How does it work?
Restasis is a very safe anti-inflammatory. It's been out for many years. We've had excellent success. Admittedly, Restasis isn't for everyone, but people that have used Restasis for the full 90-day initial therapy, many people find prolonged relief by using this medication.
Dr. Hahn, can you tell us what are punctal plugs and how do they work?
So punctal plugs are inserts that go into the tear drain. So normally our eyes will produce tears or moisture. They will coat and cover the eye, and then they will exit through the drain. And with the punctal plug, we're blocking that exiting of the tear. So we're holding the moisture on the eye longer. So therefore, your own natural tears will sit and moisturize the eye. But even when you put medicines or artificial teardrops, they will stay on the eye longer. I have a patient just last week that we put the plugs in, and we were able to get her off of her eye drops because the plugs were doing such an effective job of keeping everything there. The plugs are done in a two-step process. We put a temporary dissolvable plug in first, and that gives us a week to assess how well the treatment is working, make sure there are no problems. Once we know everything is working well, we can put a permanent non-dissolvable plug that will sit there and stay there. We also have newer plug options available. The newer plugs are less likely to come out. We also have some that sit deeper inside so they won't rub on the eyeball itself.
Yeah, I use a lot of punctal plugs, especially for patients that are traveling by air, because the humidity on aircraft is very low. And if they're going to Australia or even to Europe, they will benefit by punctal plug therapy to protect their eyes during that trip.
Now, Dr. Foster, are there any surgical options for dry eye syndrome?
Yep, and we've been covering plugs, which is a really great therapy. Some of our patients have tried plugs and really liked them, but they, for whatever reason, continue to fall out. There is a way to permanently close the tear drain, and that's a surgical option that can be very effective. Of course, another thing that's often overlooked is abnormalities with the eyelids. And if the tear film isn't distributed regularly by an appropriate blink by eyelids that are in the right position, then you can cause significant damage. And so that's something that we look at very carefully as well.
And you've had good success with that procedure.
Yes, definitely. Yeah, and something that and what Dr. Hector is alluding to is what's called chalasis, which is a disease that is very underdiagnosed and something that can mimic dryness. And unfortunately, tears don't fix it. It's something that often requires a surgery to fix.
Well, Dr. Hector, what about nutrition? Is nutritional therapy helpful?
Absolutely. If nothing else, drinking plenty of water, being well hydrated is very important in Florida. But we also rely on supplements such as omega-3, the fish oil, flaxseed oils. This thickens your tears so your eyes are better protected. They don't get tired so quickly. So we're big proponents on basic hygiene, basic nutrition. That's the groundwork where we build our dry eye therapy.
And along with some of those nutritional therapies that Dr. Hector was mentioning, those omega-3s, they really help to decrease inflammation and help to stabilize the tear film. As I was mentioning earlier, your environment can really cause dryness or exacerbate dryness. So when we are staring at a computer and not blinking, we want to try to stabilize those tears more effectively. So we have different products that we can use. We have different Gunnar computer glasses, and they have a specialized curvature, which then allows it to trap that moisture as you're staring at that computer screen.
Jill, I think you're a big fan of your Gunnar eyewear, are you not?
I do. Actually, I brought mine with me. I absolutely love my Gunnar glasses. They stay on my desk. They've really helped with my dry eyes with working on a computer. And they're comfortable. They've really helped. And I keep an extra pair in my car if I'm traveling to one of our other offices and working on a computer. They really make a difference. Really,
I don't think many of our patients know, but all of our locations have a full optical station where they can shop for these eyewear, this excellent eyewear, which we highly recommend for our dry eye patients.
It's really part of your treatment.
Absolutely.
Yes, to customize their
Right.
Eyewear. Dr. Hahn, I know that dry eyes are for our aging eyes, but what about our younger patients? Do you see dry eye syndrome with your younger?
I do. Part of that I think is also our ability to look and measure dry eye. So I think we're catching it sooner and earlier. But with my younger patients who are maybe working on a computer all day and staring at that monitor, their eyes will get dry. And you get home and then you're reading a book or you're watching TV, and that will also make them dry. My younger patients also may wear contact lenses, and contact lens and dryness, or actually dryness is one of the main reason people drop out of contact lenses. Luckily, we do have newer options for contact lenses. We have newer, more breathable, more hydrating plastics that are better and less dry. We have different cleaners that we can use that will keep the lens more moistened. So we do have different options for patients who have not been able to wear contacts or have not been able to wear their existing contacts as long as they would like to.
Dr. Foster, can dry eye syndrome come and go?
It really can. Dr. Hector mentioned earlier about some of the systemic conditions that can cause dryness, and as those conditions are, wax and wane, the dryness can go along with it. Of course, environment is a huge factor. As the heaters come on in the cooler months, the humidity drops in the house. And then, of course, in the warmer months, with the air vent blowing on the bed and the fan blowing at night, that can really dry out patients' eyes while they're sleeping. And so that's one thing I always ask my patients about. And I had a patient just the other day that really had significant relief from turning the fan off and putting a humidifier by her bed. One thing I'll also mention briefly is there's a pair of moisture night wear eyewear called Tranquilize that actually I've had a lot of success with, and it provides a moist environment for the eyes while you're sleeping.
Now, Dr. Hector, I know that you mentioned using drops earlier. How do you know which drops to use?
It is very confusing. You go to the drugstore and you see 10 different artificial tear solutions there. Unfortunately, a lot of our dry eye patients suffer from redness, and so they go straight to the drops that promise to take the redness out. And this is where the artificial tears developed a bad name, because if you use the drops that take the red out, that's another chemical, and after a while, that chemical actually becomes an aggravating factor. The safest artificial tear are the ones that have no preservatives, no chemicals whatsoever. And we promote those, such as the Oasis tears that are preservative-free. Those are safe to use as often as you wish.
The other problem with those red out drops that patients commonly will self-treat with is that initially it may seem like that's helping. Initially the redness may diminish, but the longer you use that medication, the greater chance you have for rebound redness. So then your eyes will actually be more red and harder to manage and control. So not something that we recommend.
Now, Dr. Hector, a lot of our patients are on glaucoma drops, Can glaucoma drops actually cause dry eyes?
Unfortunately, many of the glaucoma drops can aggravate a dry eye condition. And these are patients that need that medication to treat a very serious eye condition. So we work with them to alleviate what side effects they have from their glaucoma drops. By spacing their artificial tears and their glaucoma medication, we can often help relieve a lot of those symptoms. Or we may recommend a laser treatment to substitute the glaucoma drops. So that'll be even a better answer for a lot of our glaucoma patients.
I recently read a study that said that half of the patients on glaucoma medications actually have dry eye syndrome. So it's important that as you're evaluating the patient for glaucoma, you're not forgetting about some of the other aspects of taking care of their eyes.
Now, Dr. Hahn, I wear contact lenses, I work on a computer, I use drops, artificial tears. Can I overuse the drops?
Well, as Dr. Hector was mentioning, there are preservatives in certain eye drops and medication, or eye drops and medication. So if you put too many of those preservatives onto the eye, there will be a sort of a toxicity effect that can occur. If you use a teardrop that has no preservatives, you can safely put that in as often as you need to. If you're using these over-the-counter lubricant drops more than 4 times a day, then that may be an indication that you may need treatment or therapy beyond what over-the-counter can give you. And that would be a good idea, a good time to come in and have a full evaluation to see what that next step may be.
Well, now, Dr. Foster, are there other conditions besides dry eyes that you think you've got dry eyes, and it can simulate dry eyes, but it's really not?
There is, and one thing I mentioned briefly earlier was a disease called chalasis, and it basically means that the tissue on the surface of the eye is baggy, and it can pinch and can cause a lot of surface irritation. It can even cause tearing and burning, just like dryness does. However, just putting lubricants and some of the standard dry eye treatments on this condition doesn't make it go away. And so I've had a lot of success with just a fairly simple outpatient surgery to remove that excess tissue, and my patients have done well after the treatment. So it's one thing that I'm always looking for, because it's underdiagnosed and it can be a significant improvement.
And you're one of the few surgeons who's actually performing that procedure in this area. So.
Yep.
Dr. Hector, if dry eyes are not treated, can you lose vision?
Unfortunately, the answer is yes. During my fellowship, I was introduced to a lot of severe blinding disorders, and I found a very common denominator was dry eye syndrome. So as simple as it may sound, if it's not properly treated, you can develop very poor vision or even blindness secondary to dry eye syndrome.
And that's a great point, Dr. Hector, because with dry eye, many people think it may be just a little bit of a nuisance, but they don't have to do anything. But we know from studies that dry eye is actually progressive. So we want to take care of it early on while we still have a lot of options, and then prevent it from getting to that vision loss, vision threatening condition.
So this is why it is so important to have your yearly comprehensive eye exam. Very important. I understand, Dr. Hahn, that the Eye Associates is always involved with clinical studies, trying to find cures for dry eye syndrome with research. Can you tell our audience more about this?
Sure. The Eye Associates is involved in several different types of clinical studies, and dry eye is one of the major focuses that we have. The benefit for the patient of participating in a clinical study is that it allows them to have treatments and medications that may not be available otherwise. It also allows them to give back to the medical community. We use that information from the studies and the research to develop the next treatment, possibly the next cure. Also for these patients, it allows them to have free care while they're in the clinical study, and the medicines are provided, and they're even reimbursed for their time and travel.
That's a great service that the Eye Associates offers. Dr. Hector, can patients be seen at any of your offices?
Yes, we have multiple locations that extend from Sun City up in Hillsborough down to Sarasota and Bee Ridge. And all our locations are full service locations. And we provide the dry eye treatment program, the Better Tears program, I like to call it, in all of our locations.
Well, Dr. Foster, what would be the first step for a patient with dry eyes, especially if it's inhibiting their daily life?
I guess the main point I'd like to make in response to that is that you don't need to suffer needlessly. If you have a condition that's causing daily frustration, irritation, problems with your vision, and trying over-the-counter therapies is not doing the trick, that's definitely the time to come get checked. And comprehensive evaluation is very appropriate because we can prevent further damage and problems that you may encounter in the future and improve your quality of life.
So, Dr. Hahn, you do offer a second opinion for those patients who are watching this program today and they're wanting to find some type of relief.
Absolutely. We commonly see patients for second opinions. Just like Dr. Foster was mentioning, they were frustrated with what was maybe not working for them. So we gladly examine you and put together a comprehensive treatment plan and then work on getting you some relief.
And what would you recommend for the patients to do? Would they try to keep a diary, bring their drops in?
It would be beneficial if we knew exactly what drops they were using, what treatments they had done or tried in the past, and then that will help us to better tailor something that will work for them.
I tell my patients, empty your medicine cabinet, bring all those bottles in. I want to see everything you've tried so far.
To start to customize
Yes.
that dry eye program. Dr. Hector, whenever a patient goes outside with dry eye syndrome, what do you recommend for protection?
Well, as anybody in Florida needs to wear sunwear or tinted lenses when they're outside because of the brightness of our beautiful Florida sun. And with dry eye patients, especially in Bradenton or you're on the beach, you need extra protection from the wind and sand. And eyewear that wraps around and has extra protection for your dry eyes comes highly recommended.
And also with full UV protection, because in that bright sun, not only is it uncomfortable, but ultraviolet light is also damaging to the eye.
Correct. Yeah.
And polarization is another thing that I always recommend because it does cut down on a lot of the glare.
Yeah, if you're going to be around the water, you definitely want polarized sunwear.
Well, unfortunately, we are out of time. Thank you, Dr. Hector. Thank you, Dr. Foster, and thank you, Dr. Hahn, for helping our audience learn more about dry eye syndrome and what they can do to be more comfortable. And thank you, audience, for joining us today. We'd love to hear from you with your questions and suggestions for future shows. Just give us a call at toll-free 1-866-865-2020 and mention the TV show. Or if you'd like to make an appointment with one of our award-winning doctors, we'd love to see you. Just call the toll-free number on the screen. Our goal is to keep you seeing your best and enjoying your life. So for now, I wish you the best sight for life and so much more.